This is your body's digestive system. It starts at the mouth and goes all the way through the body, ending in a bowel movement. So the first thing, of course, is food. When you chew food, okay, take for example an apple or an organic apple. It's healthier. So you bite the apple and your teeth help to grind it up. When you're chewing food, you notice that you have glands throughout your mouth that secrete saliva. Saliva serves two purposes. If food is hard, it helps to soften it. And it also lubricates your throat so that it's easier to swallow. So your throat has two separate pipes. The pipe in the front is for breathing and for speaking. That's your trachea. Directly behind it is your esophagus. That's where the food goes. So how does the food go down the correct pipe? When you're swallowing food, the pipe in front, your trachea, has an epiglottis. It's like a little flap that covers over it. So the food closes that flap, blocking the trachea and guiding the food into the esophagus. So that's kind of what it looks like. The epiglottis covers the trachea and the food goes down into the esophagus. But you have to be careful. Make sure you eat slow. If you're eating quickly, then food might slip past the epiglottis and into your trachea and cause you to choke. If you eat properly and slow, then your trachea will be blocked off and you'll be okay. And sometimes if you try to breathe while you're eating, the same thing can happen. So just be careful. So the food goes into your esophagus. And your esophagus has muscles lining the wall, which helps to bring the food down. And remember, there's also that saliva there that helps to bring it down also. So, and if you eat like something that's really dry or something, you might have to take a sip of water. So it's important to really chew your food properly, make sure it's moist enough before you swallow it so that it can go down your esophagus into your stomach.